Hi everyone, and welcome to this episode of the podcast. I'm Dr. Kash Gupta. I'm a gastroenterologist and hepatologist in the UK. Today we're going to talk about the exercise prescription for fatty liver, what actually works and what doesn't. And this is going to be a reasonably big one, and I'm really trying to condense things down because I know it's a question that I get asked a lot by patients whenever I diagnose them with fatty liver. And even if they haven't got fatty liver, this argument about what exercise is best for health has been an ongoing issue. And I think what I describe for fatty liver is a bit nuanced, but it generally does apply to health in other areas. And I've tried to cover how it covers health in other areas as well, and it does apply to things like VO2 max and longevity. I've tried to make things a bit more clear with infographics and pictures and putting in references, but let me have a go at trying to explain what exercises work best and what perhaps people should be thinking about trying to do. And the answer is not straightforward. It's not just do resistance. It's not just do aerobic. It's not just do one particular type of exercise. Different exercises have different benefits. So what's the best exercise for fatty liver? It's a question I get asked almost every week in clinic. And I'll be honest, I used to give a pretty vague answer, something like, just move more, be more active, any exercise is good exercise, which is partly true. But that's not really that helpful, I think. People generally want specifics. And you want to know, should I be running or lifting weights? What about yoga? Is high intensity interval training HIIT worth the hype? So I spent a little while just diving into the research. And what I found was some of it was expected, some of it was surprising. And some things the fitness industry tells you are a little bit overblown, I think. Others are actually underrated. So today, I'm going to give you a complete breakdown as far as I can in this time span, based on actual clinical trials, not the overblown influencer science that's perhaps put out there a lot of the time, and exactly which type of exercise works best for what and how to combine them into a program, perhaps from my interpretation, that will actually improve your liver specifically. And I think if it was to improve the liver, it's going to help other parameters as well. I've tried to explain towards the end what parameters it does help. So if you were going for exercises that were improving other things, you'd focus on those. But before we get into the specifics, let me just share the single most important finding from all this research, something that I think you'll generally change how you think about exercise and fatty liver. Exercise reduces liver fat even if you don't lose weight. And I know this is a bit of a contradiction because I'm always talking about how you should try and lose 5 to 10% of your body weight to my patients to help reduce the fat content in the liver. But that is an important comment to make about exercise. You can improve your fatty liver through exercise even without the scales moving. And this is shown in multiple randomized controlled trials. And for a lot of my patients who've struggled with weight loss, this is genuinely liberating news. Exercise isn't just about burning calories. It directly changes how your liver handles fat through mechanisms which we'll discuss. And that means the type of exercise you do matters, not just how many calories you burn. So stick with me for the next 40 minutes or so. Whether you're completely sedentary or already active, I think you'll learn something that will help you make better decisions about your exercise program. So that was the first segment. Segment 2, what exercise actually changes in your liver. So Before we dive into comparing exercise types, we need to understand what we're actually measuring. When researchers study exercise for fatty liver, they look at 5 main things. Number 1, liver fat content. This is the gold standard. We measure it using special MRI technique called MRI-PDFF, and normal is less than 5%. If you have a fatty liver, you're typically above 5% on those readings, sometimes much higher. There are other modalities that can measure fat. Things like FibroScan is one of them, and more typically the percentages of fat content in the liver are a bit different when you start picking it up. But the goal of any treatment is to get that number down, reduce the fat reading in the liver. Sorry, PDFF, proton density fat is what you're measuring. Number 2, insulin resistance. We can measure this with something called HOMA-IR, and that's a calculation that's done. But think of it of insulin resistance as the root cause of fatty liver in a lot of people. Your cells stop responding properly to insulin, so your body produces more and more of it, and this drives fat into your liver. So lower is better. Number 3, liver enzymes. The 2 main hepatic liver enzymes that show liver inflammation are ALT and AST, alanine transaminase and aspartame transaminase. These are the blood tests that your doctor will probably check, amongst others. And when liver cells are inflamed or damaged, these enzymes leak out. They're not perfect markers, and certainly ALT is a more specific marker of liver injury than ALT. But when they do come down, it usually means inflammation is improving. Just bear in mind, AST can also be released from muscle. Number 4, visceral fat. This is the fat around your organs. The belly fat that's metabolically active. It pumps out inflammatory chemicals and makes fatty liver worse. You can have a normal BMI, body mass index, and still have too much visceral fat, organ fat. Number 5, cardiorespiratory fitness, or VO2 max. We could go into it, there's a lot of information on this, but here's the crucial thing. The leading cause of death in people with fatty liver doesn't tend to be directly liver failure, it's heart disease. But fatty liver is an independent risk factor for heart attacks. So you don't have to have other issues. If you just had a fatty liver, that would predict that you have a higher risk of dying from a heart attack. So improving your cardiovascular fitness isn't just nice to have, it's potentially life-saving. And these exercise techniques, some of them have better effects on cardiovascular fitness. But here's what makes the topic interesting. Different types of exercise affect these 5 parameters differently. There's no single best exercise that wins on everything, and that's what we're going to explore. That's a really important thing to remember. There's a lot of fighting amongst different scientists and social media influencers about which exercise is the best, and part of me feels sometimes people are promoting one particular exercise because they're good at it and it gains a better following. But really, things need to be individualized to a degree. And we'll talk about why that is. So part 3, aerobic exercise, the foundation. I'll start with this one, which is the big one really, aerobic exercise. Walking, cycling, swimming, jogging, anything that gets your heart rate up and keeps it there for an extended period is essentially aerobic exercise. This is probably the most studied type of exercise for fatty liver. It definitely is the most studied type, and the evidence is fairly solid. A 2023 statement from Exercise and Sports Science Australia reviewed all the meta-analysis and systematic reviews, and the conclusion was fairly clear that aerobic exercise works. Research showed essentially that aerobic exercise reduces liver fat by 2 to 4% in absolute terms. So the reading came down by 2 to 4%. And that might not sound like a lot, very much, but remember, normal is below 5%. So if you're at 15% and you get down to 11%, that's a meaningful improvement. So the percentage drop from 15 to 11 isn't overall is quite a meaningful amount. The absolute percentage is what we're talking about. And crucially, this happens even when people don't lose significant weight, so the body proportions are changing. There was a landmark study published in JAMA, Internal Medicine, in 2016 that randomized 220 people to either moderate or vigorous aerobic exercise. Both groups showed significant reductions in liver fat. The vigorous group got a bit more improvement in fitness, but for liver fat, specifically, moderate intensity worked as well. And that's really important because moderate intensity is sustainable. You don't need to be gasping for breath, but you should be able to hold a conversation, and that's the rule of thumb. If you're too breathless to chat, you're probably going too hard. And if you do that, then you're probably not going to be able to sustain that over a long period of time on average, if you look at the whole population. So the optimal dose, based on a systematic review of 23 studies, the sweet spot appears to be about 150 to 240 minutes per week for at least 8 to 12 weeks. And I think that study really did show, which was published from Australia, and they've done some really good work on exercise physiology, that you get the benefits. Most people get the benefits around 150 minutes. So you don't necessarily need to go 240 minutes. But that works out to about 30 to 45 minutes, 5 days a week. And you can do a mixture of exercises for that, essentially, if you wanted to, as long as they're aerobic. Now, 150 minutes is the minimum recommended by international guidelines, the European Association of Study of Liver Disease, EASL, and they recommend that as a starting point. But the dose response studies suggest you get an additional benefit up to 240 minutes. So beyond that, the return diminishes. So you might just get all the benefit you can up to 150. There is evidence to show you get additional benefit up to 240, but then after that, you're not getting whole. The benefit is tailing off. So what is aerobic exercise best for? 3 things stand out. First, liver fat reduction. Aerobic appears to be the king here. Secondly, visceral fat reduction, so general intra-abdominal fat. The STRIDE trial, STRIDE trial, this is a trial that looked at essentially benefits from interventions like exercise, and it first published data around 2001, and there have been ongoing follow-up publications and follow-up studies on it since then. But that trial from Duke University showed that aerobic exercise beats resistance training for reduction in belly fat. So thirdly, cardiovascular fitness. This is where aerobic exercise shines quite well, with improvements of 15 to 20% in VO2 max. So that's kind of doing moderate exercise. Think of it as probably zone two exercises. Zone 2, where essentially your heart rate is 50, 60% of max. You're able to either breathe through your nose or breathe without while you're running or jogging or whatever you're doing. Given that heart disease is the #1 killer of people with fatty liver disease, the cardiovascular benefit is arguably as important as the liver benefit itself. And remember that the cardiovascular benefits of these kind of exercise often help. You may not remove plaque necessarily that much from an artery, but you help stabilize the plaque, which is important. But the bottom line is aerobic exercise should be the foundation of any fatty liver disease program, essentially, and aim for about 150 minutes per week of moderate intensity activity. More is better up to a point, and you don't need fancy equipment. A daily 30-minute brisk walk does count. I've heard people say that walking does not count as exercise. It counts. It counts in a lot of people. It depends on who you are and what you're doing and what position you're at. It's the delta. It's the delta that you need to make. And you can't just go from being completely sedentary or being quite obese to doing a 5K. You cannot do that. Part 4. resistance training, the underrated hero. Now, I say it's underrated, but I think that's what's being promoted quite a lot nowadays, and I think for good reason. There are some really good findings that have come out from resistance training. It's very interesting. So for years, resistance training, weights and resistant bands, body weight exercises, calisthenics, was kind of overlooked for fatty liver. The thinking was cardio burns more calories, so cardio must be better. And you burn more calories, you're in a deficit, you're going to lose weight. And by the way, talking about calories, we will do a whole nother video on diet, because I think this deserved a whole video by itself. And to be honest, there's a lot more nuance that you could just talk about within this. But with regards to resistance training, it turns out that resistance training not being important was wrong. Resistance training is generally underrated for fatty liver. And in some ways, it might be better than cardio for certain people. And we'll talk about why that would be the case. There was a really good study published in Gut in 2011. Kate Halsworth and colleagues, they took people with fatty liver and put them on an 8-week resistance program. No changes to diet, no attempt to lose weight. Result, 13% relative reduction in liver fat with no weight loss whatsoever. And how is that possible? So it comes down to muscle, really. Muscle is a glucose sink, so it soaks up sugar from your bloodstream. The more muscle you have and the more active your muscle is, the better your body handles insulin. And since insulin resistance is the root driver of fatty liver, improving it makes everything better. So what resistance training is best for fatty liver? Well, first and foremost, correcting insulin resistance. A recent network meta-analysis, which is a study that compares all other studies, so meta-analysis covers lots of different studies like randomized controlled trials, found that resistance training ranked highest for improving HOMA-IR, which is the measure of insulin resistance, and through a specific calculation, which is done through fasting parameters and glucose and insulin, with what's called a sucra score, which was 71.8%, which is better than aerobic, better than HIIT, and better than combined training. So essentially, resistance training showed better markers in insulin resistance. Essentially, growing muscle increases your glucose sink. Secondly, liver enzymes improved. They measured the AST, that they showed that the AST improved. The 2023 meta-analysis done by Hejazi and Hackett found that resistance training was significantly better than aerobic exercise for bringing down AST levels. And the effect was substantial at 0.54 standard deviations, which is clinically meaningful. And thirdly, adherence. And I think this is the important thing. So what we tend to find is that if resistance training is perhaps easier to just get done, and I think things like adherence probably don't get enough attention. In the systematic reviews, resistance training programs had adherence rates above 90%. People actually stuck with it. And why is that? Probably because you can do it at lower intensity than cardio, you see visible progress in strength, and you don't get as sweaty or breathless. So, I mean, my feeling about that is that, from my own experience, is that you don't need to do as much resistance training to get benefits in terms of muscle growth than, for example, aerobic exercise and benefits from VO2 max. It takes a longer time to get a benefit from aerobic exercise versus resistance training. So resistance training, you could lift some weights with some fairly good going intensity, but not be out of breath and not, really be struggling. And after a number of weeks, you're going to feel stronger. You're going to get some benefits on muscle strength and muscle mass. Whereas with aerobic training, you have to go on for a bit longer in order to, for example, if you're going to do zone 2 training, you're going to have to go on for half an hour, 40, 45 minutes regularly, a few times a week for many weeks before you see some improvement on VO2 max. And you don't necessarily feel that as much as you do with the resistance training, I think. I think you feel the benefits from resistance training probably a bit earlier and quicker. That's my feeling on that. But who benefits most from resistance training? People with type 2 diabetes. The insulin benefits are huge. People with lean MASLD, so they're the thinner patients with lower BMIs who have fatty liver, rather than being overweight. And those people can't afford to lose muscle mass. So cardio-focused weight loss isn't ideal for them. Older adults who are at risk of sarcopenia, which is a degradation of your muscle or age-related muscle loss, and people with poor fitness who find sustained cardio really difficult. Resistance training is less demanding on the cardiovascular system generally for those people. And just a note on sarcopenia, I know a lot of times it's associated with old age muscle loss. It's not just old age, actually. We see sarcopenia in people with liver disease, and we've been talking about that for decades. So what's the optimal protocol? 2 to 3 sessions per week. It seems so on non-consecutive days. You've got rest days, 8 to 10 exercises targeting the major muscle groups, 2 to 3 sets of 8 to 12 repetitions each. That's what these studies kind of looked at. And the median intensity in studies was about 3.5 METs. So that's lower than moderate walking. So a fairly easy amount of intensity of exercise. So even when you're training 2-3 times a week with fairly low, moderate intensity, you're going to get benefits. So it's accessible even if you're quite unfit. You don't need to get breathless for it. And that's an uncomfortable feeling, getting breathless. So I can imagine why adherence is better. So the bottom line is, don't skip resistance training. It's arguably the best modality for improving insulin resistance. It's sustainable and it preserves muscle mass. If you're currently only doing cardio, adding in 2 to 3 sessions per week could significantly boost your results. You might find that your cardio sessions are better as well. Section 5, the truth about high intensity interval training. So let's talk about HIIT, high intensity interval training. This is probably one of the more recently hyped exercise modality. And you've probably seen the headlines, burn more fat in less time, 10 minutes, 10-minute workouts transform your body. We've seen that for a while. We've seen that for decades. People have been talking about HIIT in various forms, really. But what does the evidence actually say for fatty liver? The answer is a little bit surprising. First, what is it? It's essentially short bursts of very intense exercise. So we're talking 85 to 95% of your maximal heart rate, alternating with recovery periods. And the protocol that is that was shown to show some really good cardiovascular benefits on 50-year-olds after a couple of years of getting up to this certain protocol called the 4x4 Norwegian method, which is 4 minutes of high intensity training, then 3 minutes relax, and you do that on 4 cycles. So it's around 25 to 30 minutes for a whole cycle, including your warm-up. And that in particular showed some really good structural benefits to the heart when it was published. But does it work for fatty liver? Yeah, of course it works for fatty liver. There's a 2022 meta-analysis looking at 19 randomized trials, which found that HIIT reduced liver fat by 2.85% in absolute terms. So that's a real meaningful improvement. But the crucial finding here is not that it's not actually better necessarily than regular moderate cardio. The same meta-analysis found that moderate intensity continuous training, just regular steady state cardio, reduced liver fat by 2.62%. So that wasn't statistically different from the HIIT. although it was a little bit less in absolute terms. So multiple studies have now confirmed this. So HIIT is equivalent to moderate cardio for liver fat, but not superior. And you could look at this as essentially looking at, if you did HIIT, it could be, let's say 10 minutes of HIIT, it might be equivalent to 30 to 50 minutes of moderate intensity. But why would anyone do HIIT? So it's essentially time efficiency in that respect. A HIIT session takes 25 minutes compared to 45 minutes of moderate cardio for the same liver benefit, and that's a 40% time saving. So if you're generally time poor, that matters. And I suppose that's going to be important to a lot of people, the time factor. We are busy nowadays in our lives, and I certainly do try to do sessions of HIIT if I think, oh, you know what, I'm late for this and I can't do this, my jog for 45 minutes or whatever. I'll do a HIIT session, and the HIIT session might be 10, 15, 20 minutes type thing. And I don't tend to do very long ones. If you were going to do a reasonably long HIIT session of 30 to 40 minutes, you are going to be really tired, and you have to be fit to be able to do that. Really fit. But what are the caveats? HIIT isn't for everyone. It's hard. As I was mentioning, the perceived exertion is much higher than moderate cardio. You can't keep it up for as long. It requires a baseline level of fitness, so you shouldn't jump straight into HIIT if you've been sedentary for a while, or let's say you're obese and you're going to go and do a HIIT session. Be careful. If you weigh a bit more, then you could rupture your Achilles tendon, get an injury. Be careful about HIIT. Just jumping straight into it. It's great for many reasons, but you should watch out for it. Adherence can be lower because it's uncomfortable. We talked about the question about safety. However, a recent study in patients with biopsy-proven NASH, the more severe form of fatty liver, showed that HIIT was safe, well tolerated, and no serious adverse events. So if you're medically stable, it's probably fine. Look, sometimes I would do episodes of HIIT, and I wouldn't, and I'd go do short bursts of sprinting, and I'm always, oh God, I want to make sure I don't rupture my Achilles or a hamstring or something like that. So look, as you get a little bit older, be careful about HIIT. Make sure you do a warm up and try it out more gradually. Do it a little bit at a time, and then build up to it. But the bottom line on HIIT is that it's a time efficient alternative, not a magic bullet. If you enjoy it and you're reasonably fit, it's a great option. But don't feel like you're missing out if you prefer a regular walk or cycle. For your liver, the outcomes are about the same as moderate intensity aerobic exercise. And I'd suggest building an aerobic base for about 4 to 6 weeks at least, based on some of this data before doing HIIT. And even then, maybe once or twice a week as part of a varied program. And always do it with medical advice and fitness coaching advice. Make sure you're safe when you do that kind of stuff. Segment 6, part 6, mind-body exercises. The missing piece. This is really interesting, and it's not something I've been big on, but I think it's really important, and it's something that I'm looking to incorporate at some point myself. And I know my wife does it, and I've got friends that do it, and I think it's really certainly an adjunct. And it gets left out from these discussions, mind-body exercises such as yoga, Tai Chi, Qigong, Pilates. These are practices that combine movement with controlled breathing and mental focus. And I'll be upfront, the evidence for these specifically for liver fat is not as strong as aerobic or resistance training, but that doesn't mean they're not valuable. And let me explain. In 2024, there was a meta-analysis in Frontiers in Endocrinology, which looked at 14 randomized controlled trials of mind-body exercises in people with metabolic syndrome. And that's the cluster of conditions that include fatty liver, high blood pressure, high triglycerides, insulin resistance. And the findings were that significant improvements in waist circumference, down by about 2.5 centimeters. Fasting blood sugars improved, triglycerides came down, HDL cholesterol went up, blood pressure improved. These are all markers that matter for metabolic health. But here's where it gets interesting, the stress connection. Chronic stress drives fatty liver through multiple mechanisms. Cortisol, the stress hormone, promotes visceral fat accumulation. Poor sleep can cause it. Stress leads to that, and that worsens insulin resistance. Stress drives emotional eating, and it reduces your motivation to exercise. The mind-body practices directly target the stress response. They activate the parasympathetic nervous system, the rest and digest mode. They've been shown to reduce cortisol levels, they improve sleep quality, and they enhance program adherence. People who feel good during exercise are more likely to keep doing it. That's kind of why HIIT might not be for everyone. But what are the options? Yoga combines postures with breathing exercises and often induces relaxation or meditation. Tai Chi involves slow, flowing movements with continuous weight transfer, and it's sometimes called meditation in motion. Qigong is similar, but focuses more on energy cultivation through movement and breathing. And Pilates emphasizes core stabilization, control movements, and posture alignment. And, we know there's lots of variations of these that are out there. I think the important caveat here is that the mind-body exercise is an adjunct. It's not a replacement of aerobic or resistance training for directly reducing liver fat. Think of it as addressing a different dimension of the problem: the stress, the sleep, psychological factors that make everything else harder. It's important though, and it's worth thinking about, because you don't sleep well, you may not lose weight very well, may not lose fat very easily, you may not build muscle as well. So if these exercises help with that, reduce stress and what have you, then I think it's an important adjunct. It's probably something that people need to be versed in to some degree, even at a low level. My recommendation, well, it's not a recommendation. I have no recommendations, but generally 1 to 2 sessions per week, 20 to 30 minutes each, seem to be useful as an add-on to your main program, potentially. Choose whatever practice appeals to you. The best one is the one that you'll actually end up adhering to and doing. And many gyms and community centers offer beginner classes, and there are excellent online resources too. So you can see that there have been some infographics that are pictures that have been put up whilst I've been talking, because I've been trying to summarize this. And these infographics, these images, pictures, are essentially summaries of what I'm talking about. There are more detailed notes that I'll try and make available to members on the website, with more detailed charts and images. Because I think this whole topic is a big question, a massive question, and people get very confused about what exercise they're doing, and when they feel that there's no benefit, they'll end up just giving up. So one of the secrets here, I think, is that whatever you do, it's probably going to be of benefit, and don't stress too much about whether one exercise is necessarily better for taking fat out of the liver. You need to do some kind of combination. And what is best, which is best for what, is the next topic we're going to talk about. If we bring this all together, we've covered essentially 4 types of exercise: aerobic, resistance, HIIT, and mind-body exercises. And there are going to be winners for different parameters, but most have a benefit in all the different areas. But seeing how they stack up against each other, parameter by parameter, looking at the infographic, one, for reducing liver fat, aerobic exercise tends to win based on the evidence. It has the strongest and most consistent evidence base. HIIT is equivalent but not better. but it's time efficient. Resistance training helps pretty well, actually, for liver fat, but not quite as much. And that might be a reflection of you getting better body proportions, but not losing weight overall. Mind-body has limited direct evidence for reducing organ fat or liver fat. For insulin resistance, resistance training wins. That glucose sink is bigger. The network meta-analysis puts it at the top. Mind-body also shows effects here, probably due to the stress-cortisol connection. But aerobic exercise also has decent benefits on this. For visceral fat, belly fat, aerobic exercise wins fairly convincingly. The STRIDE trials showed it's superior to resistance training for this. Cardiovascular fitness, aerobic exercise wins, and HIIT. And bear in mind, there is this nuance about zone 2 moderate intensity exercise, where some people don't get as good a response to moderate intensity, and they get better responses from high intensity interval training. So some people are non-responders to your general moderate exercise. That doesn't mean that it wouldn't have any benefit at all. If it doesn't improve your VO2 max, it'll improve your body proportions, it'll get rid of fat, it'll improve mitochondrial activity and efficiency. So again, if something says that it's not as good, or people don't respond as well, there are still going to be other benefits. But essentially, aerobic and HIIT improve the VO2 max by about 15 to 20% during the exercise periods of these studies, around 8 weeks, 12 weeks. Resistance training has minimal effect here, can improve to some degree, but not anywhere near as much. And this matters because heart disease is the #1 killer in fatty liver disease. For time efficiency, HIIT wins, about 40% time savings for the same liver fat benefit as moderate cardio. Bear in mind also that resistance training does have a good time efficiency profile as well, because you can. That's arguable, but my feeling is that it might be a bit more time efficient than aerobic. For adherence, sticking with it, I think resistance training wins and mind-body wins. Both have adherence rates in various studies above 90% in them, and they're less demanding, more enjoyable for people, and they show progress soon. For stress and sleep, mind-body wins hands down. It's directly targeting the parasympathetic nervous system and documented effects on cortisol and sleep quality. But I think the key insight over here is that there's no single best exercise. They're complementary, not competing. Each excels at something different, and that's exactly why the optimal approach is to combine them. It doesn't make sense to just do resistance training. If you're looking for longevity, forget about liver fat. If you're looking to live longer, it doesn't make sense just to do weights all the time. If you're going to hedge your bets, you may as well hedge your bets and do a combination of them all. So next section, what would your action plan be? Putting it all together if it was me, and what I would be trying to do. And it's always a work in progress with me about what I'm able to juggle when job takes you into different areas, kids, family, different responsibilities that you have to take as they're getting older. And I've put a picture up here just to talk about what that program might be for, I don't know, someone like me, or someone who may be older or more obese or more sedentary, what they might work up to. Essentially, what should you actually do? And I would start with the core components. So aerobic exercise. We know from the studies, Shelley et al., from Australia demonstrated about 150 to 240 minutes a week. That could be considered a foundation. Brisk walking counts, cycling counts, swimming counts. Aim for moderate intensity. You should be able to hold a conversation while you're doing that exercise. You won't. You could be nasal breathing. Resistance training, 2 to 3 sessions per week on non-consecutive days. So you've got rest days in between. 8 to 10 exercises covering the major muscle groups. Do you know, I don't even do 8 to 10 exercises. I pick the ones that I can do in that period of time, and do 2 to 3 sets of 8 to 12 reps. That I do try and do. And I try and essentially work the main muscle groups. You can use weights, machines, resistance bands, or just your body weight. I stopped my gym membership, a while ago. It's just easier if I, go back here, get a mat out, get some dumbbells out, get a chin-up bar or something like that. Mind body exercises, 1 to 2 sessions per week. I don't do that at the moment. My wife does, and she's always trying to get me to do it. I think I might start trying to figure that out. 20 to 30 minutes of yoga, Tai Chi, Pilates, or whatever appeals to you. I think they're really good for balance as well, and balance is an issue as you become older. And this addresses also the stress dimension that the other exercises don't directly target. HIIT, I've written here as optional because some people just may not be able to get fit enough to do HIIT. Or if you're going to do HIIT, you just do a milder form of HIIT. So for example, if you were cycling, you might go 30 seconds a bit hard and rest for a minute or 2 minutes. And your hard rate might not be 90% of your maximal heart rate. It might be 80%, but it's going to have benefits if you do it. And you may do that for 5, 6, 7 minutes. You may find that if you did that for a year, you'd then be able to do it for 15 minutes. And you may be able to go on for 2 minutes of high intensity level. So I think if you're already reasonably fit and time poor, then you can substitute one or two of your cardio sessions with HIIT, but it's not essential. And I think that that's what I do. If I think that I haven't got time for a long cardio session, I'll do a HIIT. So for example, this morning was a zone 2 low level Sunday morning 45-minute jog. I don't feel particularly tired or stressed by that. I think if I was to do HIIT, I might be slightly sore, and I'd feel a bit different. But I think if I didn't have time, then I might do a HIIT session. So a sample week might look like Monday, 30 minutes walk plus 30 minutes weights. If you're having a look at the infographic, Tuesday, 30 to 45 minutes cycling. Wednesday, 30 minutes weights plus 20 minutes yoga. Thursday, rest or a light walk. Friday, 30 minutes swim, 30 minutes weight training. Saturday, 45 minutes jog or 25 minutes HIIT. And Sunday, 30 minutes Tai Chi or Pilates. And sometimes it's, if you're busy for various reasons. For example, I got a couple of kids and they're not young, they're not, toddlers or babies, but I can now incorporate them into the exercise program. So for example, I've got at the moment they're 6 and 9 years old. The 9-year-old can run pretty well and runs with my wife. I'll run on a Saturday morning with my 3-year-old and we might do 30 minutes of very low level, jogging and running, depending on what she can cope with. And that just manages to get me out and take them with us rather than going to the gym by myself. Anyway, that overall gives you about 165 minutes of cardio, 3 resistance training sessions, 2 mind body sessions, and adjust according to your schedule and preferences. It sounds like a lot. It is a lot. It is a lot when you're busy, but certainly, I'll try and make videos in the future how I think that how things are set around your life, what I call life sets, helps to incorporate these things into your schedule, because my belief is that with fatty liver on the rise as it is and obesity on the rise as it is, we can be very critical about it being your lifestyle choice as being the error. I don't think it's as simple as that. I think we're being pushed into these situations where we find it difficult to do the right thing. And I think trying to set the right things as your default around your life is what we have to work on. And that in itself takes hard work, I think. Anyway, the expected results should be within 8 to 12 weeks. You can expect to see liver fat drop by 2 to 4% according to these papers. Insulin resistance improves, liver enzymes come down, and fitness increases by 15 to 20% via VO2 max. And remember, these benefits happen even without dramatic weight loss. So my point about this is that you can do all the exercise, not necessarily lose a lot of weight. You can improve your body proportions. You can improve your muscle mass, your mitochondrial efficiency, your VO2 max, if you follow a program like that for about 8 to 12 weeks. And I'll leave you with a final thought. The best exercise program is the one that you will actually do. Consistency beats perfection a mile off. If all you can manage right now is a 15-minute walk, start there. Movement is medicine, and every bit counts. If you found this helpful, please subscribe, share it with someone who might benefit. And if you want the full scientific breakdown with references, I'll put the references at the bottom. I've created some other premium documents for members that go into much more detail or a bit more scientific detail. But thanks again for watching this. Please do look after yourself, look after your family. This is an important topic, a real rising cause of disability and death and needing liver transplants. The liver is the metabolic powerhouse of your body. It is ignored by a lot of doctors and a lot of scientists. It's brushed past, but I think it's the bottleneck of where all the problems start happening. Thanks for watching this episode of Liver and Guts, and hope to see you in the next one. Take care.